Hi, everyone. Hope you're enjoying the conference so far. Thanks so much for choosing to spend a couple minutes checking out my poster today. My name is Victoria Sagal. I'm the lead of patient involvement at the Canadian Medical Association Journal, or CMAJ. And on behalf of myself and Dr. Andreas Lapakis and Dr. Kirsten Patrick, I'm excited to be able to present our work to you today. So this study, which we've called Patient Involvement in CMAJ Publications from 2018 to 2022, really had the goal of understanding how much of CMAJ's content involved patient perspectives or recognized patient contributions over this period. And this is because in 2021, we adopted a policy to encourage the inclusion of patient perspectives in the journal and wanted to have a baseline to evaluate how we're doing as we move forward. So just before I get into the nitty-gritty of this project, in case anyone here is not familiar with CMAJ, CMAJ is Canada's Medical Association Journal, and we publish original research about healthcare, as well as ongoing clinical education for physicians, analyses and commentaries about different issues related to healthcare. We also produce original news articles. We have journalists on staff, and also a number of social media aspects such as blogs, podcasts, etc. So as I mentioned, in 2021, we officially announced and launched our patient engagement program with the goal of finding ways to increase the inclusion of patient perspectives across the whole journal. And I don't have a lot of time today to get into the background about that, but if you'd like to take a moment to scan this QR code on your screen, that will bring you to our statement of purpose, which explains a little bit more about the rationale of why we chose to do this. But if patient involvement is brand new to you, the two important things to know going forward with this presentation is that every time I say patient, I'm not only meaning those who have personal experience with a health condition, but also family member, informal caregivers, and friends. And patient involvement is a broad term referring to a number of different activities that have the meaningful and active collaboration of patients or patient partners that can span the gamut of article creation, and all sorts of intellectual contribution to content published in CMAJ. So as I mentioned, our goals for this work really were to understand how much of CMAJ's content included patients during 2018 to 2020, and the modes in which they were involved, with the goal of using this data as a baseline to evaluate how we're doing going forward. So we basically took a look at articles, blogs, and podcasts published in CMAJ over this period to understand if any patient involvement was present in these articles. So in articles specifically, it was said to have patient involvement if one of the authors was a patient, or if the text mentioned the contributions of patient partners in any way, or if an article featured a profile or interview of the patient. For podcasts, it was counted as having patient involvement if there's a patient interviewee, and a blog had patient involvement if there was a patient author. So looking at results overall, over this 3-year period, we had 973 articles that appeared in CMAJ. 40 of these articles were explicitly in supplements where we were trying to encourage submissions that talked about patient involvement. So when we exclude these from analysis, we have a better idea of CMAJ's true baseline for involvement over this period. And that is essentially that there were 62 out of 933 articles published during this time that had patient involvement, for an overall percentage of 6.6% of articles involving patients in some way. When we take a look at podcasts, that number is slightly higher. 10.3% of podcasts had a patient interviewee, and overall blogs, 28 or 8.7% of the blogs were written by someone who was sharing their experience as a patient or family member. If we dial in a little bit more to look at only the articles published during this time point and the types of involvement, or the ways that patients were involved in these articles, the most frequent method of involvement was having a patient author, co-author listed on these articles, with the second most common method of involvement being asking patient groups for feedback. So for example, having an advisory group or community partners that would inform the work, but were not necessarily listed as authors on the work. And just drawing your attention back to the table 1 on the top, you'll be able to see that under the guidelines and humanities headings, These were the two types of articles that CMAJ published that had the highest percentages of patient involvement during this time frame. So guidelines, you can see that 85% of all guidelines published over this 3-year period involved patients. And this is likely because the GIN reporting guidelines, which CMAJ asked authors to complete, specifically request that those creating the guidelines involve affected populations or communities in drafting the guideline. In the humanities section of the journal, where 17.4% of all articles had patient involvement, we publish a type of article called Encounters, where one person reflects on an encounter they've had in healthcare, either delivering or receiving care. And a large number of these articles were written by healthcare practitioners or researchers speaking about their experiences in healthcare, which is likely why we had a high percentage there as well. So overall, this study has given us a really good idea for how much of CMAJ's content prior to 2021, when we launched and adopted the policy, involved patients. And just to recap again, that's 10.3% of podcasts, 8.7% of blogs, and 6.6% of articles that involve patients in some capacity, with the guidelines and humanities sections in the articles having the highest and most consistent type of patient involvement. So going forward, we'll definitely be keeping an eye on future years in the journal and comparing them back to this baseline to see whether we're doing better at including perspectives of patients more frequently over time. But we're also using this as an opportunity to see if there's other ways to encourage and support submissions from people whose perspectives may not have been heard in the journal. As I mentioned, the humanities section had a large number of people whose backgrounds were in healthcare. So seeing if there's ways that we can encourage those that do not have this training and familiarity with the system to share their experiences with the journal. So that's my time for today. Thank you so much for listening. And I've left my email at the bottom of the slide here. I'd love to hear from you if you have any questions. And if not, thanks very much for taking the time to be here, and enjoy the rest of the conference.